Hello, and welcome to G Fun Facts Online, your go-to source for fascinating insights into the world around us and inside us. Today, we're diving deep into a topic that affects millions: chronic pain. But we're not just talking about the ouch factor. We're exploring how chronic pain is deeply intertwined with our emotions and, excitingly, how groundbreaking research is showing us ways to retrain our brains to fight back. So what happens when pain sticks around long after an injury should have healed, or when it appears without a clear cause? It's not just a physical sensation, it's a multifaceted condition that can seriously impact emotional well-being, often leading to anxiety and depression. The latest research is shining a spotlight on the brain's emotional processing pathways, revealing they play a crucial role in both how we experience chronic pain and how it persists. Let's take a peek into the brain's emotional landscape when chronic pain takes hold. It's like a city where some districts become overactive and others underperform. For instance, the prefrontal cortex, or PFC, our brain's CEO responsible for decision-making and emotional control, often shows decreased gray matter and altered activity. This can make it harder to manage the negative emotions that come with pain. Specifically, the medial prefrontal cortex, involved in emotion and motivation, can have its connectivity changed, influencing how we perceive pain. Then there's the amygdala, the brain's alarm system for fear and anxiety. In chronic pain, it can become overactive, cranking up pain perception and, sadly, is linked to higher depression scores. Imagine your fear center constantly on high alert. That's what some people with chronic pain experience. The anterior cingulate cortex, or ACC, is another key player, processing both the sensory "ow, that hurts" part and the emotional "oh, this is awful" part of pain. Chronic pain can make the ACC hyperactive, locking it into a feedback loop with emotional centers that amplify negative feelings and, you guessed it, pain itself. Our hippocampus, crucial for learning, memory, and emotional regulation, isn't spared either. It can undergo structural and functional changes, like reduced gray matter, which is linked to pain persistence and emotional disorders. The insula, our internal body sensor, also shows altered activity in chronic pain, contributing to both the sensory and emotional aspects of the pain experience. And it's not just about brain structures, it's about the chemical messengers too. Neurotransmitters like serotonin, dopamine, GABA, and glutamate get dysregulated. For example, a decrease in GABA, an inhibitory neurotransmitter, in the medial prefrontal cortex can lead to amplified emotional responses. Disruptions in dopamine pathways, especially in areas related to reward, can make us less responsive to positive things and more sensitive to pain. All these changes can create a vicious cycle. Pain fuels negative emotions, and those negative emotions crank up the pain. It's a tough loop to break, which is why just treating the physical symptoms often isn't enough. But here's the truly exciting part. Our brains are not set in stone. They possess an incredible ability called neuroplasticity, the capacity to adapt, reorganize, and form new neural connections throughout life. This opens up amazing possibilities for therapies focused on retraining these emotional circuits to alleviate chronic pain. So how do we actually retrain the brain? Several innovative approaches are showing immense promise. First up is Pain Reprocessing Therapy, or PRT. This system of psychological techniques helps people unlearn chronic pain by teaching the brain to interpret signals from the body more accurately and less threateningly. It involves psychoeducation, somatic techniques like somatic tracking, well, get to that, and emotional processing. Studies are showing fantastic results, with a significant number of participants reporting being pain-free or nearly pain-free. Then there's Pain and Emotion Therapy, or PET. This is a novel e-health intervention that focuses on boosting the brain's capacity for emotional processing. It aims to help individuals de-escalate negative emotions and enhance positive ones. Trials have shown it can lead to significant reductions in pain intensity and improvements in emotional regulation, depression, anxiety, and sleep, often delivered through group video sessions and an app. Mindfulness-based interventions are also powerful. By practicing non-judgmental attention to present experiences, including pain, individuals can modulate their emotional and cognitive responses. fMRI studies show mindfulness can regulate activity in brain regions like the ACC and insula. Meditation and breathing techniques are key here. Cognitive behavioral therapy, or CBT, helps individuals identify and change unhelpful thought patterns and behaviors related to pain. It can even increase gray matter volume in areas like the prefrontal cortex and reduce catastrophizing, that tendency to imagine the worst-case scenario. Pain neuroscience education, or PNE, is all about understanding your pain. It educates patients about the neurobiology of pain, concepts like central sensitization and neuroplasticity. This knowledge can reduce fear and promote adaptive coping strategies, altering activation patterns in the brain's emotional centers. Biofeedback is another fascinating technique. It uses monitors to make you aware of physiological processes, like heart rate. With guidance, you learn to recognize how these link to stress and emotions, and then learn to regulate them, leading to reduced pain. Somatic tracking, which I mentioned earlier, involves focusing on physical sensations, especially pain-related ones, without fear. By observing sensations with curiosity and reassuring yourself of safety, you can neutralize the emotional response, allowing the brain to reprocess pain messages more effectively. Let's not forget movement-based therapies, like physiotherapy and hydrotherapy. These help build strength and flexibility safely and gradually, teaching the brain that certain movements don't need to trigger a pain response. Hydrotherapy, using water's buoyancy, is particularly good for easing movement. And finally, neurofeedback. This involves real-time monitoring of brain activity, providing feedback that helps individuals learn to self-regulate their brain patterns, potentially altering pain processing pathways. Looking ahead, the future of chronic pain management is incredibly bright. Our growing understanding of the brain's pain-emotion interplay is revolutionizing treatment. We'll likely see these techniques become even more refined, new ways to track treatment progress using neuroimaging, and more personalized interventions. Technology, like e-health platforms and virtual reality, will also play a bigger role in making these brain retraining therapies more accessible and effective. So the key takeaway here is hope. By empowering individuals to reshape their brain's emotional responses to pain, these innovative approaches offer not just temporary relief, but the potential for long-term improvements in pain, function, and overall quality of life. That's all for this episode of G Fun Facts Online. Join us next time as we explore another fascinating corner of science. Stay curious.